Welcome back. We've been joking during the break. So we're going to now talk about a couple of human service related projects that we have within the county. One is the Healthy Futures Initiative, which is actually HFI, which used to be the Drug Free Communities Coalition. So it's a program that used to be under the Summit Prevention Alliance. A group of folks under the Summit Prevention Alliance that was absorbed into county government a few years ago and was rebranded Healthy Futures. So talk a little bit about a big project that they've got going on now, Dan.
Yeah, well, there are a lot of partners within that group. First of all, there's Arapahoe Basin, the Community Care Clinic, all the towns. And so they're trying to figure out what the impacts are locally to marijuana. And we all know that marijuana is more or less been decriminalized. And they're really trying to figure out what the impacts are, and they're putting together a survey to figure out, what's the general sentiment in our community on marijuana use. And when I was in Europe or when we're in Denver, everyone's always asking what's the usage? What are the impacts that we're seeing from a county perspective? Of course, the towns are benefiting from sales tax, but what are the real impacts to our community? And this is a way to gather as much information as possible from everyone in the community. You have an opportunity to weigh in by going to a simple website and completing a survey on what you think the impacts are, what are the positive, negatives, and you name it. So with that information, we'll be a step ahead of a lot of other communities that are still trying to figure out what is a community really, what are the impacts, and what does it mean to have marijuana in our backyard, more or less.
There's an absolute realization with the legalization of marijuana in the state of Colorado for adults that sends a message to our kids, right? And so I think that there's not just a lot of people in human services or public health, but a lot of folks that are out there in different foundations that are saying, how do we explain to our kids how to make healthy decisions and not misinterpret what the legalization of marijuana in Colorado means to a youth. And so this is some, fairly new ground that a lot of people are trying to figure out in terms of you need a more sophisticated message than, just don't do that, right? Never mind what your parents are doing or what the rest of society is doing, just don't do that. And then there needs to be a realization, I think, by adults themselves, your behavior and what you do or what you don't do does have a significant influence. And so there's a lot that we sort of need to figure out here in terms of how do we best go out. And this is something that our county has, struggled with for a lot of years, right? And not just marijuana, right? Any kind of abuse of a substance. And what's the underlying reason behind that and all the rest. So thank you to the towns for funding, because certainly it's the towns that are in right now anyway the retail marijuana business. The county doesn't have any of those sites yet, but again, a very good collaboration in terms of how do we best go forward and help our youth as well as adults, that have influence on youth, understand the do's and don'ts, or the decision making that should be involved before you decide to do something with a substance. And particularly now marijuana, given that new message that's out there with legalization in Colorado.
And it will be coupled with the Healthy Kids Colorado survey, which is administered within the middle and the high school. So we'll have some of the questions associated with this survey are very similar, different audience obviously than the children, but it'll be a good opportunity for us to gauge how do the school-age children respond to those questions. How do adults and parents and young adults respond to those questions as well, and get an understanding of what are the different perceptions of substance use or substance abuse within our county. And as Thomas, as you said, there really aren't any other similar surveys. We're really out there sort of on the front end of this trying to get this information. And part of that is because, as you also mentioned, we've got a somewhat long history of substance issues within Summit County. And so we want to be on the forefront of that and try and understand how can we reduce that activity level or that trend of substance abuse that we see.
Yeah.
So to participate in the survey, go online right now, and you have until Friday, November 30th, but go to cronainsights.com/scpublic. And Crona Insights is a Denver-based market research firm that was contracted to help facilitate this process. So again, hopefully you see this in the bottom of the TV screen, but you have until November 30th.
And I'm sure our top-notch crack producer will have that rolling. So
But we would
fantastic.
love your participation.
Yep, absolutely.
And you don't need to be a parent of a school-aged child for this. We want everybody participating in this. It really is important to get a wide range of inputs from a lot of different people. So I encourage you to tap that into your computer and take the survey.
Yep, absolutely.
And it's absolutely confidential.
Yeah. And it says that several times. Karin and I have both taken the survey already as parents of school-aged children. So, all right. Let's see. Employment First, Karin. So another human services program that you have some familiarity with. So talk about that.
Yeah, so the bigger picture here is that we were operating under the Workforce Investment Act, WIA, and last year Congress passed the update to that, which is Workforce Opportunities and Innovation Act, which is along the same lines.
Wow, 4 letters is so much better than 3, right?
And it's innovative. And so the improvements there include a lot more focus on helping people who are the long-term unemployed. It's easy to get someone back to work who has just worked and recently was laid off. But the long-term unemployed, people with substance abuse problems, people with mental health problems, sadly a lot of veterans that were having a hard time getting back to work. So there's a lot more focus on those folks that are more difficult. And so part of that is connecting human services at the county level with the workforce centers, and we were ahead of the curve. We already had some good communications and we were working together, but this now solidifies it in law that you must work together, because what was happening in many places is that we had some duplication of services, funding that was similar to help people in looking for a job, getting resources to be able to look good to go to an interview, to get the training, and even to deal with substance abuse issues. So all of those now are coordinated with this new position and should provide much better service to people and less redundancy, less opportunity for fraud as well. So it's a good streamlining. And so some of the opportunities here are that there is funding to give people some work experience without you actually going out and hiring them. If you're a nonprofit organization or government organization, you can offer some opportunities for someone to get a little work experience, maybe at the Rotary dinner helping with, or Rotary breakfast, helping with serving that food. Could be an opportunity where there is funding to pay that person. The entity taking it on as a host is not actually taking on any liability or any payment, but just offering an opportunity for someone.
Yeah, so great opportunity for folks to get some job skills, some real world experience, to go out and do interviews with those prospective employers, and to, again, just be able to get back into the work environment and into the workforce.
Right, and not ask the employer to take all the risk.
Right, exactly. All right, so great program, and that is underway, started just within the last several weeks that was launched. So fantastic work there. All right, we'll take a quick break. We'll come back. We'll talk about some planning efforts that are underway within the county as well.